I'm Roger Norfolk from St. Joseph Hospital, and we're here today to demonstrate the proper setup and use of the Respironics Vision non-invasive ventilator device for to do mass ventilation for the nurses at St. Joseph Jessamine. To get us started, as we take the machine into the patient's room, we want to make sure that the oxygen is connected to the high pressure oxygen outlet, the oxygen hose, and then also the electrical cord is connected into an electrical outlet. And while we have the machine turned to the back, you take note that the on-off switch is the white button in the back, and we'll return to that a little bit later here. So we'll turn around and focus to the front of the machine, and then next we should do the demonstrate the proper setup of the circuitry itself. And we need about basically 3 parts: a bacteria filter and the circuit itself, and then also a Respironics mask that will go on the end of the circuit for the patient. So to assemble the bacteria filter, simply place it on the large bore outlet of the machine, and then on the outlet of that filter goes the large bore hose of the circuit itself goes there, and then there's a pressure line that's also attached to this circuit, and that needs to attach to the small bore port that's right above the large bore outlet there. Okay, so now we have our circuit that is attached to the Vision, and then on the end of that is a attaches your Respironics mask nicely, and it comes with headgear with 4-point connection there, or Velcro strapping that you can tighten it down from 4 points, and it goes over the top of the patient's head, and then connects in the front at each of the 2 points at the top and 2 at the bottom. But first, let's turn the machine on now and do there's a self-test that's required, so we're going to go back to the white button and simply turn the machine on. And it takes it for just a few seconds to come up, and then it's going to ask us to do a exhalation port test. And by the way, the exhalation port is in the circuit here. It's a small opening or hole that's right beside the pressure line, and that is the patient's exhalation port. So it should never be occluded, as that's a safety concern if that were to be occluded. It's because flow continuously goes out there. So the second control from the top left here, it says that test exhalation port. So we're simply going to press that button there, and then we're going to occlude the end of the circuit, but not the exhalation port itself. And over on the top right it says start test. So we want to start test, and it only takes a few seconds to do this, and this is testing the integrity of the circuit itself for leaks and so on. Okay, now it says test is complete on the screen, so now we're ready to attach mask and to place it on the patient. We can go ahead and put in monitoring mode, press the monitoring screen, and then there's a standby button over here on the lower left. You can put the machine in standby itself until we get your proper mask fitting and so on achieved. So the package that the mask comes with a nice sizing gauge at the top, and the 3 choices for size are small, medium, and large. But it's best to put the top of the mask should fit at the bridge of the nose, and then the bottom of the mask at the cleft of the chin, right below the lower lip. Should give you most appropriate sizing, and most patients will actually require a medium mask. The largest percentage of your patients will, but there is a nice sizing gauge there on the package to help with that. So the mask itself goes on the end of the circuit, such as this. Okay, and you are basically ready to go. But before we do that and place it on the patient itself, we need to put settings in, of course. So let's go and talk about modes and settings. Now, this machine only delivers through 2 modes, of which one is going to be exclusively used by you guys there at Jessamine, and only use what's called the ST mode, which gives a backup rate, versus the other mode is a CPAP. But to make sure you're in the right mode, simply press the mode button, and then if the CPAP comes up here in the top right, you're actually already in the right mode as far as the ST goes. Okay, so now we go back to parameters and set the parameters that are desired. So you're going to set 4 main parameters. You're going to set an IPAP, an EPAP, a respiratory rate, and an FiO2. Okay, so let's talk about the I and the EPAP. So you've got a patient in impending respiratory failure, whether it be from ventilatory failure or from hypoxic failure probably. Their worker breathing is really hard, and and they don't look good, and you're trying to avoid intubation. So we probably want to set an IPAP setting anywhere from the range of 15 to 20, and that's in centimeters of water, and an EPAP setting anywhere from probably 5 to 8 centimeters of water. Okay, and if they really have increased worker breathing and you think they have a CO2 issue and they're not ventilating well, you need to make the gradient in between the two numbers as wide as possibly can, probably something like 20 over 5 or something of that nature. And then also give them a pretty decent backup rate, anywhere in the range of probably 14 to 18 and maybe sometimes even 20. The next setting below that is called time inspiration or inspiratory time. We'll just leave that set at 0.8 and that'll be fine. So you shouldn't have to deal with that. Top right is your FiO2, so that's the 4th important setting. So it's never wrong to start anybody on 100%, so until you see what your saturations and so on are doing, so you can turn that to 100%. And by the way, making changes on all these settings, you simply highlight what you want to change and then turn the control knob down here, and I'm turning here to your desired number that you want to achieve. And you do not, and then it's real time, and you do not have to press that button again or anything. So that's your 4 main settings: your IPAP and your EPAP, your respiratory rate, and your FiO2 after choosing your mode. And since you guys are only going to use the one mode, I think that mode of ST will probably be in there from your last patient, and you won't have to achieve that mode. Okay, the other thing that you need to set is alarms. So this button here, you can choose your alarms. Okay, so as far as we want to bracket your IPAP number, so if you choose a 15 of IPAP, you want to put your high pressure on 20 and your low pressure on 10. So that's 5 above and 5 below your IPAP setting. Low pressure delay, we usually set on 30 seconds, so that'll probably be already set. The apnea is, we usually just go ahead and disable it because it can be a nuisance backup alarm sometimes. Alarm-based flow, you can negate that also and not worry about that. That's for giving nebulized treatments. And also the top right, you got some more alarms as far as minute ventilation goes. We can disable that one. But then below that, you have a high rate and a low rate alarm. So you probably want to set your high rate, I don't know, 45 to 55, but it definitely has to be above what the patient's total respiratory rate is, and somewhere above that, and then the low rate probably of 8 to 10, somewhere in that range. So now we have our settings done, and then we have our alarm set, so we're ready to put it on the patient. So as we mentioned before, as far as this mask goes, you're probably going to have a couple of these, the bottom ones probably are going to be undone, and you're going to come over the top of the head with this headgear and place it, gently to the patient, and you might want to approach them slowly with it because sometimes, as you know, there'll be some anxiety components there that will play into the picture, and you kind of have to approach the patient sometimes gently to get them to be compliant with these pressures and a mask such as this. So come over the top of the head with the headgear, and even your 2 top ones connected, and then you can plug in each one at the bottom, or you can snap each one in place at the bottom right and left here. And then, as we talked before, these are Velcro, so you can snug each of the 4 points up a little bit to the patient, gently to the patient, with your Velcro straps here. And you do have to get it snug and tight, but not real tight. You can there can be some leak there, and the machine will actually achieve the settings that you have set with some leak involved. As far as then another thing to look at when you're monitoring, you want to look at the what the volumes and rate the patient's doing, and maybe the patient leak itself. So to demonstrate that, since we don't have a real patient, I'm going to actually attach a test lung to the end of this circuit, and I'm going to show you on the screen here that some of the volumes that we get out of our settings that we chose here. So we're looking at, and it's going to vary a lot on this test lung here too, but you can see here the lower left here, you can get a tidal volume and a minute ventilation, but then the next in the middle at the bottom there, it shows the patient leak. Of course, we have no leak with this test lung that I have because it's a closed system now, but with a mask in place, you will have a leak, and acceptable there is probably anywhere from zero, but zero up to probably 30 of leak is probably acceptable, 30 to 40, and you'll still maintain your pressures. So that will be something that you might want to monitor a little bit, is what tidal volumes and so on they're getting and how much leak they have once the patient is on the device. Now the patient is on the device, and if at a later time you need to give them meds, or they're better now and you want to give them a break, you can simply just remove the mask from the patient. So you'll have the mask on, you'll just probably take the bottom, just like we placed it on, and probably take the bottom 2 points off and place, and then to place the machine in standby. If it's in the monitoring screen, you can actually go to the standby here toward the lower right and press that, and the machine will just sit in the standby mode for you until you place it back on the patient, and then it would reactivate at the settings that you had previously. The alarms